If you have bad breath, it is likely that you have gum disease. And regardless of what you've been told, there is a solution. Hi, I'm Dr. Bobby Chhoker, general, cosmetic and implant dentist based here in Sydney. Come on a journey with me as I show you behind the scenes in my life and in my clinic. The problem with bad breath is that people don't really want to let you know. They don't want to hurt your feelings. And it only gets to a point where it's really bad and you notice. This affects your social interactions, your relationships, and most importantly, it affects your confidence. Not only is all of this happening, but you're in pain. You're constantly having the teeth treated again and again and again, and they're not getting any better. In fact, some of them are getting worse. So, what can you do about it if you have gum disease? Well, the first thing you can do is come in and talk to a professional. That's very important. We're here to help you, not judge you. When you do come in, we can then have a look at things and see how bad it is. Quite often, in severe cases of gum disease, or periodontitis as it's known, the disease attacks a bone and will eat large amounts of bone and completely resorb from your jaw. In these cases, quite often patients are told that there isn't a solution and that they definitely can't have implant treatment. This is not true. Conventional implant treatment means that we place straight implants all the way across the jaw so we can restore the jaw with, let's say, a bridge on these implants. There are other techniques that we can employ to actually get the same result without having to have all that bone at the back. All we actually need is the bone in the center. And the process involves placing 4 or 6 implants in each jaw and then giving you an entire set of teeth on top. This is known as all-on-4, full mouth rehabilitation, teeth in a day, Teeth Express. I have a number of people come and see me with gum disease and severe gum disease looking for a solution, but one person in particular sticks out recently. This gentleman, a lovely gentleman, came in and the gum disease had got so bad that the front teeth had moved so far forward out of his mouth they were beyond his lower lip, so they could be obviously seen. He was embarrassed, he was demoralized because he tried to get it treated again and again. So he came in looking for a possible solution. We came in on one day, had the surgery done with the implants, and within 24 hours, he had a full set of teeth in his mouth. This immediately made him far more confident because he could smile again. Not only that, he was then able to eat whatever he wanted. He told me that he hadn't eaten an apple in so many years because he was afraid of a tooth coming out. He couldn't bite into one before. He hadn't eaten corn on the cob. He hadn't eaten a steak. He was really existing. He wasn't living. And just to see the smile on his face and how happy he was and the change in the quality of life and his confidence is what we're about, and that makes us really happy. I understand this is a big step to take. You really need some courage to come in and talk to us, and we're here to look after you. We're not here to judge you, and you're in good hands. I am a master's clinician in implants. I have a master's degree in implant dentistry. I have been placing implants for 23 years. Not only that, our practice is patient orientated. You are what's important. You just need to start the conversation. It doesn't matter if it's a phone call, you want to be consulted online, or you want to come in and talk to us face to face, which is ultimately what we prefer. When you come in for your consultation, which is completely free, we put together a program of treatment. And just like anything else, if you follow the program, we get the end result that you want, make you really happy, we're happy, and that end treatment is, because it's so predictable, has longevity. That plan will have the number of appointments you need, what's been done at each appointment, the length of the appointments, the intervals, and most importantly, it'll have an entire breakdown of the itemized costs. And to help you, we have 3 financial solutions. We can also break the treatment plan into sections and phases and spread that out to help you as well. All you need to do is come in and start that conversation. We have the solution for you, we have the cure for you, and we have the financial support for you.